Hi, everyone. My name is Nicole Burke. I'm a health education specialist here at the Community Healthcare Network in the South Bronx. Today, I'll be educating you on the topic of hepatitis C as a sexually transmitted infection, but with a specific focus on how it affects the queer community. So, what is hepatitis C? Hepatitis C, also known as HCV, is a virus that attacks the liver. If it goes untreated for too long, it could lead to more life-threatening issues such as chronic liver disease, cirrhosis, or even liver cancer. What makes hepatitis C so tricky is that most people don't show any symptoms at first. This is why it's often referred to as a silent epidemic. Hepatitis C is a major and growing health concern, especially for queer people who face additional risks and barriers to care. So, how does it spread? Hepatitis C is mainly transmitted through blood-to-blood contact. This includes things like sharing needles or injection tools, unprotected anal sex, especially when there's rectal trauma, and sharing razors, toothbrushes, or tattoo equipment that isn't sterile. In LGBTQ plus communities, especially among HIV positive men who have sex with men, sexual transmission is widely recognized. Co-infection with other STIs increases the risk. The incubation period is typically 2 to 12 weeks. Some people may never feel sick, but when symptoms do happen, they can include fatigue, nausea, dark urine, and yellowing of the eyes, which is called jaundice. Even after treatment, reinfection is still possible. Now we can talk about how hepatitis C progresses in the body. There are three main stages. Number one is the acute infection. This is the first 6 months after someone gets the virus. Some people, about 1 in 4, are actually able to clear the virus on their own without any treatment. But most people don't even know they're infected at this stage because symptoms are often absent. Chronic infection occurs if the virus isn't cleared in those first 6 months. It becomes a long-term infection. This is what happens in most cases. The virus stays in the body and slowly damages the liver over time. The third stage is the advanced stage. Without treatment, chronic hep C can lead to serious complications. This includes cirrhosis, which is scarring of the liver, liver failure, and even liver cancer in severe cases. Unfortunately, many queer and trans people are diagnosed late because of stigma, healthcare, avoidance, or just being overlooked by providers. The delay means they're more likely to reach the advanced stages before even getting help. The good news is that hepatitis C is curable. There are medications called direct-acting antivirals like Merivet and Epclusa that can clear the virus in 8 to 12 weeks with a success rate over 95%. But access isn't equal for everyone. In Black and Hispanic queer communities, they often face huge barriers when it comes to treatment. Some people are often afraid of being misgendered or dismissed by providers. Others don't have insurance or face delays. And many queer people avoid care altogether because of past medical trauma. Okay, now let's take a look at the numbers. In New York City alone, there are more than 314,000 people living with either hepatitis B or C. Among HIV positive men who have sex with men, the rate of new hepatitis C infections is about 6.35 per 1,000 persons per year. This is significantly higher than in the general population. The impact on transgender women is especially alarming. About 4% of white trans women tested positive for hep C, 7% of Black trans women tested positive, and 16% of Hispanic trans women tested positive. I will say, these numbers are likely undercounted due to stigma, fear, or limited access to care. The real rates in the queer community are likely to be even higher. So now that we've seen the numbers, let's talk about what's behind them. For HIV positive gay and bisexual men, risk is shaped by things like condomless sex, group sex, and co-infections with other STIs. Black and Hispanic trans women are often navigating a healthcare system that doesn't see them, doesn't listen to them, or treat them with dignity. All of these factors contribute to missed screenings, delayed care, and higher risk overall. For queer people who use drugs, there are even fewer safe spaces to access harm reduction, clean supplies, or judgment-free testing. All of this exists with the context of stigma, medical trauma, and institutional bias, which means that most vulnerable people are often least likely to be reached by traditional healthcare services. This is why it's so important that prevention and treatment efforts are designed with queer people in mind, not as an afterthought, but as a priority. How do we prevent hepatitis C? The best answer would be by using primary prevention measures, which means stopping exposure before it even happens. Here are a couple of primary prevention methods that you can use. Using condoms and gloves for sex, and avoid sharing needles, razors, or tattoo equipment. Secondary prevention is about catching it early on. Routine screenings are necessary for the queer community and people living with HIV. Testing for Hep C should be part of every sexual health visit. Tertiary prevention is about managing the illness after diagnosis. This can include getting treated early on, monitoring your liver health regularly, and speaking with providers about reinfection risk. Stigma is a huge barrier to care. Many queer people avoid testing or treatment because they've been judged, misinformed, or ignored by healthcare systems. The best thing we can do to combat these issues is to use inclusive and affirming language, making sure that everybody's care is confidential and safe, and hiring peer navigators to build trust and support within the community. Here's what can be done to take action. Providers can offer affordable and judgment-free testing. The city can create more funded peer-led outreach and education programs. And providers should receive more training in queer and trans health literacy. Lastly, we should normalize talking about Hep C in general. Hep C should no longer be a taboo topic. Hep C is curable, but stigma and systematic inequality keep it alive. Here are all the sources I used to gather research I presented in this PowerPoint. That's all we have for today. Thank you very much for joining me and being a part of this conversation. Always remember to keep showing up for one another and creating systems that truly include all of us.
Blue or pink? Blue or pink?
Just give me a second, I don't even know.